forcing the world to change seemingly overnight. The global pandemic brought several issues to light. In the healthcare industry, it helped people see the vital and often overlooked role that nurses play.
When the pandemic hit, it caused us to innovate or start to innovate in healthcare, right? So we had a pretty quick pivot, and I'm talking both financially, from a stability perspective, as well as clinical delivery of care, right? So it really turned that upside down. So what used to take us weeks and months to make decisions on, we were making hundreds of those decisions daily. Nurses has always been very important to the healthcare system. They're really the center of the universe for patients, especially in an acute care hospital environment. So they're not only taking care of the patient day to day, but they're also helping connect the dots. They're really the connective tissues between whoever is going in and out of the room to provide them some episode of care.
According to the World Health Organization, although 27 million nurses and midwives make up nearly half of the global health workforce, those same professions also represent 50% of the shortage in healthcare workers today.
Some of the dynamics that go into the nursing shortage from an overall pre-pandemic and post-pandemic, you gotta have enough schools, you gotta have enough faculty, you gotta have enough people interested in the field, right? So something the COVID-19 pandemic did for nurses and other healthcare providers is it caused a high degree of burnout too. Now, operational performance has long been an opportunity, even pre-pandemic. So it's something that we were behind as an industry on, trying to catch up. The pandemic, again, it shed light on some of our vulnerabilities, like how do we do more with less, essentially, right? The easy way to say it.
At present, supply and labor challenges, coupled with ever-evolving changes in digital intelligence and technical innovation, are pressing leaders to modify underlying processes.
With labor supply, one of the things that they'll look at is the value of investing in either automation or certain types of technologies. Automation, we've found, can significantly change the environment for a manager. Technology is often related to automation, but it has its own nuances. And over the last couple decades, we've seen some significant changes, and in particular in the availability of information for management. Improving performance and then sustaining that level is difficult for any organization. And it's not for a shortage of ideas. Most of the organizations we work with have a tremendous amount of ideas on how to improve. The difficulty is in distilling those ideas into things that are usable and then communicating them throughout the organization. The problem for managers in organizations to try to do this is often a question of resources and time.
Now, developments in operational performance are helping organizations achieve and sustain higher levels of improvement.
Developments in organizational performance, I break into two things. One, it's how we improve and what we improve. In terms of the how we improve, I think a lot of it is around technology, whether it's automation, robotics, or even virtual meetings. On the what we improve, I think it's all around the operating model. The global pandemic has changed businesses and it's changed the consumers. If you look at our employees, there's not enough employees, there's a transient workforce, and there's a lot more work from home or remote workers. When we talk about the supply chain, it was once very predictable. We knew what to order, we knew when it was going to arrive, and that predictability has gone away. There is one constant though, and it's people. Change management and adoption is still required. In the healthcare setting, often these improvement initiatives are around better asset utilization. As we get better usage, we get shorter wait times, and as a result, better access to care. When we have labor shortages or medical supply issues, we don't see as many patients, and the assets, the beds and the ORs, sit empty.
For large healthcare networks, staying up to date with the latest technology can be difficult, often requiring capital and change in order to improve performance.
The reason we made an investment in creating an outpatient facility in this marketplace is for years we had actually promised the community to build a hospital here. But when we actually looked at the data and all the different advancements and things that have happened with technology, we felt we could deliver a high proportion of the care direct to the community without ever building a hospital bed in this market, which would also lower the overall cost of care and allow us to provide a triage and stabilization service. The overall operating model isn't just the facility, it's actually creating an environment in which the people work to deliver the care that's important. And so if you looked at all the design features in this facility, you can see it's warm, it's inviting, it creates space. And so we've avoided over 1,000 transfers a year where they would have previously had to have gone to a hospital, and now they can reside in their community where they're close to their loved ones, close to their family, and an area of comfort.
By evolving with infrastructure, organizations can work across functions to enhance processes and systems, while modifying the skills and behaviors of both employees and managers.
As we all know, healthcare continues to change, and there's a movement of care from the traditional hospital-based care to a lot more services being delivered in the outpatient setting. That's happened because of technology advances, safety and anesthesia, skill sets that are able to allow us to deliver care differently. Nobody really wants to be in a hospital. People would prefer to be closer to home. They prefer to have services in the outpatient setting. And so if we don't keep pace with where people want their care delivered, we become less relevant to the marketplace. The way I've always thought about a system of care is you have to have a complex set of assets, things like home health, a long-term acute care hospital, things like a nursing home, home care, just anything that the patient really needs to have the service rendered to them. And again, those changes are being driven by advances in technology, and so we have to continue to evolve the model. There's also a lot more people who would like to have a digital experience in healthcare, like telehealth, and the ability to connect either synchronously with their doctor or their provider, or asynchronously through a patient portal and communicating through things like email. So when we use the word access in healthcare, we have to think much more broadly to be relevant in the industry.